the years, MS TeamWorks has shared perspectives on MS from all members of the MS team. And although 2020 brought unexpected challenges, we were determined that a pandemic and social distancing would not stop us from sharing new and meaningful perspectives. The setting was different, but the message is the same. I have MS. I have a team. I have a future.
Hello, my name is Elizabeth, and I'm the nurse for the Multiple Sclerosis Clinic at the Children's Hospital of Philadelphia. As a subspecialty nurse, I accompany physicians into patients' visits, help to manage follow-up care and recommendations. I also provide education on procedures, medications, and follow-up. Overall, I work as the liaison between the patient and the physician. There are a few challenges that young adults can face as they're living with MS and getting ready to leave the nest. Young adults can have difficulty advocating for themselves and navigating the healthcare system. These are skills that are not taught in school. There is no curriculum to follow to help to learn these skills. It is about stepping out of your comfort zone and speaking up. In order to do this, you need to pay attention and ask questions. Here are some examples. What medications do you take and why? How often do you take the medication? Why do I need another MRI? What symptoms are you experiencing? Do you have numbness in your right leg or your left leg? Details are important. What are you feeling that does not make sense to you or is new? If you as the patient do not understand something, speak up. You are much more likely to follow through on a plan if you understand the reasoning why behind what we are asking you to do. Also, navigating a healthcare system can be extremely challenging. There is a difference between the pediatric and adult world. In the pediatric world, there may be more hand-holding and helping to keep track of everything that you need to do. While in the adult world, you are responsible for carrying out your own healthcare plan. Make sure that you have the tools to be successful. This may include, who do I contact when I have a question? Always know your contact person and how to reach them. This is extraordinarily important. They will be able to help guide you as to what you need to do and who else you may need to contact. So learning to advocate for yourself is a learned skill. Start young. There are studies out there that show you should start to learn how to advocate for yourself and become literate in the healthcare system when as early as school aged. That's really early. Start small and slowly allow yourself to gain confidence. For example, can you ask a question at each visit directly to the provider? Then you can build up and slowly be the one that confirms all the medications, why you take them, and when you take them. If a term that is used in the visit is unfamiliar, speak up. Ask, what was that? I didn't understand that. These simple tasks will allow you to become comfortable and gain confidence in yourself, and most importantly, feel heard by your care team. As you become comfortable, ask your parent or guardian to let you answer questions first. If they have something to add after you've finished, then they can go ahead and add what they want to add, but let you speak first. It's also really easier to advocate for yourself when you're around people who make you feel comfortable. This is finding a team that you feel safe and secure with. The relationship between the care team and the patient is 50-50. No one party should be speaking more than another. You should walk out of the appointment feeling heard and that you both have a plan that makes sense and that you can follow. Ask yourself, do you feel that you can open up to your care team, even with those really uncomfortable topics that nobody really wants to speak about? Invincibility is a very natural feeling that almost all young adults have. The world seems full of endless possibilities, and overall, they feel well, and you can often forget that you even have MS. And while our goal is to make you feel as good as possible and have an overall quote unquote normal life, we as providers need to make sure that you understand the work that needs to be done in order for you to keep feeling good. Feeling good is a result and a combination of consistency, some repetition, and overall adherence. In order to help ensure that one continues to feel well, the treatment plan needs to be followed. It is important as providers that we meet the patient and family where they are at. What is important in your life, and how might the MS have an effect on it? Do you understand what is going on in your body, even when you feel really good? This is about creating buy-in with not just you and the caregiver, but as the whole team. Working in pediatrics, we recognize that this is not just about the patient, it's also about the family experience as well. We need to not only meet the patient's needs, but the collective's family needs as well. It is important to talk about goals in life and how to achieve these goals despite any obstacles that may come up health-wise. Technology is incredibly helpful in this transition process. It seems that everybody has a smartphone in their hands pretty much at all times. Let's use it to our advantage. There are different apps that you can download to remind you to take medications, track MS symptoms, or even encourage healthy habits such as meditation and yoga. Also, most importantly, a lot of providers use secure apps as part of their practice. Use these apps. These secure apps can help keep track of appointments and other testing, as well as give one the ability to refill medication, and most importantly, send a message directly to the physician. This way, you can send a message to your care team as soon as you think of it, even if it is off business hours. As soon as the office opens up, the care team can get back to you. This way, you also can skip having to make a phone call and possibly waiting on hold. If there are questions of a sensitive nature, sometimes writing it down and sending it directly to the provider and not having that face-to-face conversation is a really easy way to open up a topic that you may have concerns about that you're not quite ready to speak about face-to-face. Even if you do not have a smartphone or do not like using apps, you can simply set the alarm on the phone to ring when it's medication time. This is incredibly important and will just help get you into the routine that you need to make sure you are compliant and adhere to the medication as prescribed. The best example that I can give of a more successful transition is a patient that I met when they were only 14. Right away, a lot of anxiety was noted on both the patient and the parent's part, but very slowly, over time, we are able to encourage questions to allow the whole family to feel more comfortable with us as a team. This was done with extra clinic visits and also keeping in close contact via phone. As time went on, the patient started to feel more comfortable with us and then start to ask questions themselves during the visit. In turn, we as a care team started to direct more of our questions directly to them instead of to their parent. For instance, I would quiz them at visits about the different medications they were on and why. This really helped to create an open dialogue and a relationship of trust between us all. When it came time for college and when prepping for college, we talked about accommodations that would help them succeed and help them feel supported as they went through this major life event. Now, as they are getting ready to transition, they feel in control of their healthcare and feel comfortable speaking up and advocating for themselves. The patient themselves is now the one that calls in when scheduling an appointment or if they have any area of concern. Parents are still very much involved, but they let the patient speak first and then they give their point of view. Despite being as prepared as the patient and family feels, it is still important that we continue to validate that they feel apprehensive leaving the nest to the unknown world of adulthood. Overall, this transformation has been incredibly rewarding to witness. I feel complete confidence that both the patient and the family can continue on their healthcare journey with success. Start young. That's what I want you to take away from this video. It is important to remember that transitioning to adult care and becoming comfortable managing one's own health does not happen overnight. It starts with little steps like just knowing who to call when a question or concern arises. Becoming healthcare literate takes time during not only the clinic visit, but also at home as well. I strongly encourage all patients and caregivers to work at this together. At home, when refilling a medication, do this task together. Learn the process together. When paying a copay, talk about what a copay is and what you are doing as you do this with insurance. Healthcare and insurance is a whole other language that one needs to become comfortable with. Healthcare literacy is a lifelong education and skill that consistently needs updating. It is not only disease specific, it is institution specific, and everything changes over time. Everything is constantly evolving. Overall, remember that it is never too young to start teaching the patient to invest in their own healthcare, whether they have a chronic disease or not. I also want you to remember that each transition is unique. The process is going to look different for every person, for every family, for every institution. And it is okay to try different processes as you move through the line. This is not a one-size-fits-all approach. For some, it is better to transition on the earlier side. For some, you need to wait a few years. What timing will work best for the patient? That's what we need to keep in mind and think about. Lastly, ask for help. I cannot stress this enough. If there are challenges that you are experiencing, let the care team know. It is your right to speak up and speak out and making sure that your questions are getting answered. Leaving the nest and transitioning to adulthood should happen at your own pace and when you feel comfortable so that we can help guarantee success in the future.